From the firm 9 Square, Adam Ferrari.
We have become fat, and we're slowly dying. We've drive-throughed and convenience stored and Amazon and one-clicked ourselves into a sedentary lifestyle that's put enormous pressure, no pun intended, on a healthcare system that can never keep up. We've remade the city in our image, and we've become increasingly lazy and fat. Over the last 50 years in the United States, the percentage of adults who are considered obese has steadily increased. In 2010, 1 in 3 adults was considered obese. But that increase tracks right along with the annual vehicle miles traveled in the US. We stopped designing cities for people, and every hour spent in the car leads to a 6% higher chance of becoming obese. How did this happen? Well, the interstate system and the personal automobile provided us with amazing convenience. But the promise of suburbia was an experiment aimed at economic growth to solve a societal problem. It was not a city design problem, but it has created one. This perverse manifest destiny of smooth traffic and ample parking has devastated our personal health and wealth and decimated our natural environment and resources. We've made everything so convenient that we've consolidated things and made ourselves fragile and able to collapse, where one foreclosure takes down the whole system. Ecosystems are at their most resilient when they're diverse and rich and experimental. We now rely on our cars so much we won't walk from shop A to shop B to restaurant C. This is a no walking zone. But we can transform that. We can turn C into a drive-through. We'll add a whole bunch of sidewalks that no one's ever going to walk on, and we'll claim success. We're literally dying in our cars. The number one cause of death amongst kids under 19 is auto accidents. For accidental deaths, it's auto accidents by far. Shouldn't we rethink building a school on the edge of town that requires us to drive, as opposed to investing in a mixed-use neighborhood where walking to school makes a car trip obsolete? When we used to design cities for people, we embraced redundancy and inefficiency. This is that same neighborhood from 1953, and circled are all of the markets and grocery stores. Every resident is within a 5-minute walk of a place to get food. Super inefficient, super redundant, extremely healthy. In small and mid-sized cities across America, the daily decisions on design are literally making our health worse. We need to go back to a system where we design streets and neighborhoods and housing for people. Our overall health depends on it, and it starts with design. As an architect, I felt there was something I could do, so I funded a campaign on Kickstarter to create a mobile studio for community design that would go out and engage the public in design decisions, design discussions. What was causing the problems that they felt, and how could we come up with a solution, a design and a vision that they could work toward, advocate for, and be inspired by? That was something I could do, but you can all do something as well. You can participate in the design of our cities. It isn't hard, but it isn't convenient. It requires showing up, and it requires leadership. So medical institutions, healthcare systems, public health authorities need to find ways to advocate for better design. That's neighborhood design, healthy food access, and opportunities for healthy, active living. It starts by choosing walking over driving, and it ends by designing our cities with humans in mind. And humans were made to walk. We are literally made for walking. But it isn't just the ability to walk that's going to overcome that parking lot. For a walk to be taken, Jeff Speck theorizes that it needs to be useful, safe, comfortable, and interesting. Well, here's a useful walk that lacks any design. It's hardly safe, comfortable, or interesting. There's no place to cross the street. There's no street trees. It's probably very hot. There's a bunch of parking lots next to sidewalks. But that same street can be transformed with design into something that is safe, comfortable, and interesting. We add bike lanes, we add on-street parking, we add a clear place to cross the street, architecture that's accessed from the sidewalk and not from a parking lot, and infill that's contextual. And these are all elements of design that we can do, because people power health. We can all make change happen. So show up and do something. Don't ask for permission. You can do this, and it's not going to take down the entire system. That's the beauty of it. But you need to be there, you need to be present, and you need to participate. We can retrofit the suburbs. We each have that power. It isn't hard. Fighting cancer is hard. Losing a child is hard. Participating in the design of our cities is not hard. When you show up for a street widening or a development or a planning effort, you're making your voice heard, and you're making change happen. So remember when that happens next time to participate, and also remember that cities were made for people.